Let's do some NCLEX practice questions. Okay, so let's look at question number 1. A nurse develops an itchy red rash after repeated use of latex gloves. The nurse asks what type of reaction this most likely represents. Which explanation is most accurate? Letter A. This reaction is caused by an immediate type 1 allergy to natural latex proteins. Letter B. Switching to powder-free latex gloves will prevent future skin symptoms. Letter C. Applying an oil-based hand cream before gloving will reduce the risk of latex sensitivity. Or letter D. This reaction is a delayed type 4 response to chemicals used during glove production. Okay, so the correct answer is letter D. This reaction is a delayed type 4 response to chemicals used during glove production. So allergic contact dermatitis from latex gloves is commonly a type 4 delayed hypersensitivity reaction. It is usually caused by chemicals used in glove manufacturing, not the latex protein itself. Let's go to question number 2. A patient recently received a bone marrow transplant. A few days later, the patient develops a pruritic skin rash and reports severe abdominal pain. The nurse recognizes that these findings are most consistent with which complication and treatment approach. Letter A. The recipient is rejecting the graft, so the plan is to change to another immunosuppressive regimen. Letter B. The symptoms are expected adverse effects of immunosuppressants, then reduce the medication dose. Letter C. The donor marrow is attacking the recipient's tissue, which is managed with immunosuppressive therapy. Or letter D. The symptoms are related to dry air and diet changes, so use skin moisture measures and adjust food choices. So the correct answer is letter C. The donor marrow is attacking the recipient's tissue, therefore managed with immunosuppressive therapy. So this is what we call the graft versus host disease. It occurs when transplanted donor immune cells attack the recipient's tissue. Common findings include the following: skin rash, itching, abdominal pain, diarrhea, and liver involvement. So the treatment includes immunosuppressive therapy. Our next question. The nurse is planning care for a patient who is 2 days post-operative after an anterior-posterior resection with a new colostomy. Which tests are appropriate for the RN to delegate to the licensed practical nurse or licensed vocation nurse? Select all that apply. So we have letter A, irrigate the new colostomy. Letter B, provide initial teaching about ostomy care and peristomal skin care. Letter C, observe the stoma and document its appearance. Letter D, measure and document the amount, color, and odor of ostomy drainage. And letter E, empty the ostomy pouch and record the output. Okay, so you have your answers. So the correct answers are letters C, D, and E. So letter C is correct because the LPN or LBN may observe and document expected findings, including stoma color, edema, and appearance. The RN remains responsible for interpreting abnormal findings and charging or changing the care plan. Letter D is also correct. because monitoring and documenting drainage characteristics are within the LPN/LVN role when the patient is stable and the task does not require independent RN involvement. And the last correct answer is letter C. Emptying the stomach pouch and measuring output are routine care tasks that may be assigned to an LPN or an LBN as well as a trained assistive personnel depending on the facility policy. Okay, so let's go to question number 4. The nurse is reviewing the function of a fenestrated tracheostomy tube. Which statements describe this type of tracheostomy tube? Select all that apply. Okay, letter A, the cuff inflates on its own without active inflation. Letter B, cuff pressure does not need to be checked. Letter C, the tube has 2 separate external lines with one opening above the cuff. Letter D, the patient can speak while the cuff is inflated if an air source is detached. Letter E, airway blockage can occur if the speaking steps are not followed correctly. Or letter F, air can move more around the tube and through the fenestration, allowing speech when the cuff is deflated and the tube is cuffed. Okay, so there are only 2 correct answers here. The correct answers, y'all, are letter E and letter F. Okay, so letter E, and a fenestrated tracheostomy tube requires correct sequencing. If the cuff is inflated and the wrong cannula is used while the tube is capped, airflow can be blocked. And the last correct answer is letter F. A fenestrated tube allows air to pass through the window and up through the vocal cords when the cuff is deflated and the tube is capped, allowing the patient to speak. Okay, so next question. The nurse is caring for a patient at risk for pressure injury. Which intervention has the highest priority for both preventing and managing pressure issues? Letter A, apply a pressure-reducing surface or device. Letter B, massage red and bony areas with lotion. Letter C, turn and reposition the patient at least every 2 hours. Letter D, use lift shifts or trapeze bars during movement. Okay, so did you choose letter C? Because that's the correct answer. Repositioning relieves pressure, restores blood flow, and prevents tissue ischemia. It is the priority intervention for pressure prevention and treatment. Okay, so let's go to the next question. A patient has an elevated carbon dioxide level in the blood. Which additional blood chemistry change should the nurse expect? Letter A, an increased carbonic acid with decreased hydrogen ion concentration. Letter B, decreased carbonic acid with decreased hydrogen ion concentration. Letter C, increased carbonic acid with increased hydrogen ion concentration. Or letter D, decreased carbonic acid with increased hydrogen ion concentration. Okay, y'all, the correct answer is letter C. When carbon dioxide rises, it combines with water to form what we call carbonic acid. Carbonic acid then breaks down and releases hydrogen ions. Therefore, you have more hydrogen ions and your pH is going to be low, leading to respiratory acidosis. Okay, next question. The nurse is caring for a patient with external otitis. Which intervention should be included in the plan of care? A, Flush the ear canal with body temperature saline several hours after applying lubricating drops. Letter B. Place an ear wick in the external canal before each dose of ear drops to spread the medication. Letter C. Instruct the patient to place antibiotic drops in the ear before swimming to prevent recurrence. Letter C. Administer ear drops without touching the dropper to the ear and keep the ear position upward after instillation. Okay, so if you chose letter D, that is the correct answer. The nurse should avoid contaminating the dropper by touching it to the ear. After instilling the drops, the ear should remain positioned upward for a few minutes so the medication can coat the ear canal. Next, during the early emergent phase of a major burn injury, which laboratory pattern should the nurse expect? A. Increased hematocrit, decreased serum albumin, decreased serum sodium, and increased serum potassium. B. Decreased hematocrit, decreased serum albumin, decreased serum sodium, decreased serum potassium. Letter C. Decreased hematocrit, increased serum albumin, increased serum sodium, increased serum potassium. Or letter D. Increased hematocrit, increased serum albumin, decreased serum sodium, and decreased serum potassium. Okay, y'all, the correct answer here is letter A. In the emergent phase of a burn injury, fluid shifts from the vascular space into the tissues. This causes hemoconcentration, so the hematocrit level is going to go up. Albumin and sodium move out of the bloodstream in with the fluid shifts, so they are decreased. Potassium rises because the damaged cells release potassium into the bloodstream. Okay, so next question. A 75-year-old patient breathing room air has the following ABG results: a pH of 7.4, PaO2 of 74, O2 sat of 92%, and bicarb of 40 millimeter mercury. PaCO2 of 40 millimeter mercury. Which action should the nurse take first? A. Record the findings in the patient's chart. B. Repeat the AVG in 1 hour to confirm the results. Letter C. Encourage coughing and deep breathing to improve alveolar ventilation. Or letter D. Start continuous pulse oximeter to monitor the patient's oxygenation. Okay, so the correct answer for this question is letter A. For an adult patient, a PaO2 of 74 and O2 sat of 92% can be an expected finding. The pH and the PaO2 and PaCO2 are normal, and there is no evidence of acute respiratory distress. The nurse should just document these findings in the chart. Question number 10. The nurse receives evening hand-off for a patient who has posterior nasal packing placed earlier in the day for epistaxis. Which assessment should the nurse complete first? A. Check the patient's temperature. B. Ask the patient to rate the pain level. C. Inspect the nasal drainage, dressing for drainage. Or letter D. Assess oxygen saturation with pulse oximetry. Okay, y'all, the correct answer is letter D. Posterior nasal packing can obstruct airflow and increase the risk for hypoxemia, especially during sleep or in older patients. The nurse should assess oxygen saturation first because airway and breathing are the priority. Okay, so next question. The patient arrives in the emergency department with an acute asthma exacerbation. Which assessment finding is most concerning? Letter A, pulsus paradoxus is present. Letter B, breath sounds are severely diminished with no wheezing. Letter C, the patient uses accessory muscles and reports feeling unable to breathe. Letter D, respiratory rate is 34 breaths per minute with increased pulse and blood pressure. Okay, so if you chose letter B, you got it right. Letter B is correct answer. Severely diminished breath sounds with absent wheezing can indicate minimal airflow. This is a big danger sign because the patient may be progressing towards respiratory failure. Okay, so let's go to the next question. A patient with mild COPD is having an acute exacerbation and is very short of breath. The nurse identifies an ineffective breathing pattern related to airflow obstruction and anxiety. Which action should the nurse take first? Letter A, administer the patient's scheduled bronchodilator medications. Letter B, perform chest physiotherapy to help loosen respiratory secretions. Letter C, give oxygen at 5 liters nasal cannula until the shortness of breaths improve. Or letter D, place the patient upright with the arms supported on the overbed table. Okay, all the correct answer is letter D. Sitting upright and leaning forward with the arms supported helps the patient use accessory muscles more effectively. This position can actually quickly improve ventilation and reduce anxiety during dyspnea. Next, a 20-year-old patient is seen in the emergency department for fatigue and poor appetite. The patient takes Dilantin for seizure control and also uses oral contraceptives. Which type of anemia is this patient most at risk for? Letter A, aplastic anemia. Letter B, hemolytic anemia. Letter C, iron deficiency anemia. Or letter D, folic acid deficiency anemia. If you answered letter D, that's the correct answer. So Dilantin, pinotoin sodium, can interfere with folic acid absorption and metabolism. Long-term use increases the risk of folic acid deficiency anemia, which may cause fatigue, weakness, anorexia. Okay, so next question. A patient is admitted with a sickle cell crisis. Which nursing intervention should be included in the plan of care? Letter A, encourage frequent ambulation. Letter B, apply anti-embolic stockings. Letter C, restrict sodium and oral intake. Or letter D, administer prescribed continuous opioid analgesics at therapeutic dosages. Okay. Correct answer. If you choose letter D, that's the correct answer. Sickle cell crisis causes severe ischemic pain from blocked blood flow. Continuous opioid analgesia may be needed to control pain and prevent worsening stress and oxygen demand. Next question. A patient is admitted for evaluation and treatment of thrombocytopenia. Which nursing action is the highest priority? Letter A, check the patient's temperature every 4 hours for fever. Letter B, keep the patient on strict bed rest to prevent injury. Letter C, assess for headache, dizziness, or confusion. And letter D, remove oral crusting and scabs with a soft toothbrush several times daily. Okay, y'all, the correct answer is letter C. Headache, dizziness, vertigo, and confusion may indicate intracranial bleeding because thrombocytopenia places the patient at risk for serious bleeding. Neurologic changes require priority nursing interventions. Okay, so next, while assessing a patient's popliteal pulse, the nurse palpates a vibration over the artery. How should this finding be documented? Letter A, weak thready pulse. Letter B, brewy over the artery. Letter C, bounding pulse. Or letter D, thrill over the popliteal artery. Okay, correct answer is letter D. A thrill is a palpable vibration over a blood vessel. It may indicate turbulent blood flow and should be documented as thrill at the assessed artery. Okay, so next question. A nurse is caring for a patient immediately after a transesophageal echocardiogram or TEE. Which action has the highest priority? Letter A, monitor the patient's ECG rhythm. Letter B, monitor the patient's oxygen saturation. Letter C, assess vital signs including blood pressure, heart rate, respiratory, and temperature. Letter D, keep the patient NPO until the gag reflex has returned. Okay, all the correct answer is letter D. So during a TE, the throat is numb to allow probe insertion. The patient must remain NPO until the gag reflex returns to prevent choking and aspirations. Okay, so next question. A female patient has a total cholesterol level of 232 and an HDL level of 65. The other patient, who is a male patient, has a total cholesterol of 200 and an HDL of 32. Based on these findings, which patient has the greatest cardiac risk? Letter A, the male patient, because his HDL level is lower. Letter B, the female patient, because her HDL level is higher. Letter C, the female patient, because her total cholesterol level is higher. Or letter D, the male patient, because his total cholesterol to HDL ratio is higher. Okay, y'all, so this requires a little math here, but the correct answer is letter D. So the male patient has the highest cholesterol to HDL ratio. So how did we know that? So if you divide 200 divided by 32, because that's the male patient's result, you're going to end up with the ratio of 6.25. The female patient ratio is actually a little bit lower, which is you divide 232 divided by 65, you're going to end up with 3.57. So a higher ratio reflects a greater cardiac risk. So the correct answer is letter D, and that's the male patient. Okay, so our next question. A patient is prescribed atenolol. Which mechanism best explains how this medication lowers blood pressure? So letter A, it relaxes arterioles by blocking calcium entry into the vascular smooth muscle. Letter B, it reduces sodium and water retention by blocking aldosterone effects. Letter C, it lowers cardiac output by reducing heart rate, contractility, and renin release. Or letter D, it causes vasodilation by reducing sympathetic signals from the central nervous system. Okay, so everybody knows that atenolol is a beta blocker, right? So the correct answer is letter C. A beta blocker lowers blood pressure by slowing the heart rate, reducing myocardial contractility, lowering cardiac output, and decreasing renin release from the kidneys. Okay, so our last question. A 78-year-old patient is admitted with a blood pressure of 180/98. Which age-related changes may contribute to this patient's hypertension? So this is an older patient. Select all that apply. Letter A, decreased renal function. Letter B, increased baroreceptor reflex responses. Letter C, increased peripheral vascular resistance. Letter D, increased adrenergic receptor sensitivity. Letter E, increased collagen and stiffness to the myocardium. Or letter F, loss of elasticity in large arteries from atherosclerosis. Okay, so this is a select all that apply, and there are in this question 4 correct answers. They are letter A, letter C, letter E, and letter F. So let's start with letter A and let's look at the rationale. So letter A is correct. Aging can reduce renal blood flow and kidney function. This can affect sodium and fluid regulation, which may contribute to increased blood pressure. Letter C is also correct. Peripheral vascular resistance increases as blood vessels become less flexible. Higher resistance makes the heart pump against more pressure. Letter E is also correct because aging can increase collagen in the myocardium, making the heart stiffer. This can contribute to impaired filling and higher pressures. And the last correct answer is letter F, because large arteries lose elasticities with atherosclerosis. Stiffer arteries increase systolic blood pressure and widen the pulse pressure. So that's the end of our NCLEX practice quiz for this video. If you're able to, like the video and follow the account. Thank you for watching.